Well, good morning. It's another beautiful sunny day in Sonoma County. Today is Wednesday, June 17. Today we're going to look at some numbers of Sonoma County. I have Dr. Gary Green here with me today. But before we get to that, Gary, I have a quick question that I haven't heard before. We talk about all the safety measures we have, but I don't really understand. What is the rule for gloving? For instance, for me, should I be using gloves in all my encounters with my patients during the day?
So thanks very much. It's nice to be back again. I miss seeing everyone. Gloves are an important part of personal protective equipment, but some people like to wear gloves all throughout the day because they're very nervous. And we know in the hospital setting that if someone wears gloves continuously the whole day without changing them between patients, that actually is dangerous. Because people who wear gloves out of anxiety actually don't wash their hands as much. They think the gloves are protecting them. And so it's okay to wear gloves if you want to, and some specialties do, like dermatology sometimes will wear gloves in between patients because they're poking at skin rashes all the time. But if you're going to wear gloves for each patient encounter, you want to take the gloves off and wash your hands before and after each patient encounter. So it's not necessary to wear gloves throughout the whole day. It's not necessary to wear gloves with each patient. But if you want to wear gloves, you don't want to wear them continuously because you actually build up a lot of sweat and bacterial growth under the gloves if you don't take them off frequently.
Okay. Well, let's turn to the numbers in Sonoma County. You know, we've all been reading about multiple states that are spiking with their numbers or having surges, and indeed we're not immune perhaps to some of the social things that are happening here in Sonoma County. We've been opening up our communities. We're now a good 2+ weeks past a big 3-day Memorial Day weekend. We're 2+ weeks past protests, large numbers gathering, often without masks. But we haven't seen a spike here in Sonoma County. What do you think of that? What are the numbers?
So in Sonoma County, our numbers are slowly going up, but you're absolutely right. We have not seen a spike from all the recent events happening in the press. And so fortunately for Sonoma County, we haven't seen a spike. We're still under surge. Sonoma County has done really well at lowering the case rates of coronavirus. I'm going to show a graph. This is a graph from Sonoma County Public Health. This is an epidemiology graph. If you look at this graph, you'll notice that over time, as we move to the right, the number of daily cases that are positive for coronavirus go up. So overall, our testing rate in Sonoma County, 2.1% of swabs are positive. But a few weeks ago, it was 4%. And so our testing rate has gone down. That means two things. We're testing more people, and we are seeing more symptomatic cases come into clinics and come into hospitals. So it's a combination factor. But we haven't seen the Sonoma County epidemiology curve flatten yet, and it hasn't gone down. So we've flattened our curve, we've lengthened and broadened the curve, but we don't see, we're not at the peak yet. So we're still going to see a number of more cases, we're still going to see a number of more hospitalizations, and we're still going to broaden our testing. But in Sonoma County, we're still in the setting of the pandemic, and we're still not at the peak yet. We're not on the downslope of that. So we still need to be very careful about everything we're doing. Opening up the community at a time like this could be dangerous if we don't continue to do everything very carefully and follow the lead of the public health officer.
So should we be doing anything differently? Are we doing the right thing still for our safety measures?
So I think we've done everything perfectly well. I mean, we've really been careful. You're going to make mistakes in a pandemic. You're going to make mistakes in a disaster. And we really limited those mistakes here. So I've made a little outline here. So this is an outline of what I think we've done really well. We need to keep doing these. I'm calling these safety measures. 1, patients are screened with symptoms 4 separate times before an appointment. They're screened at the phone. They're screened at the front door of every building. They're screened by the PSR. And they're screened by the medical assistant. So that's just the symptomatic questions for screening. If those patients screen positive, they're sent to a respiratory clinic. Now we're ensuring and insisting that all patients and staff wear a mask when they're in the buildings. And patients and staff also have temperature checks before they reach the buildings. We're restricting and limiting the number of visitors that are coming in with patients. And that's really limiting crowding, and that's limiting other people bringing in the virus, even if they're asymptomatic. I think we're doing great with enforcing social distancing in all areas of the clinics, and including in the elevators. And I think people are still being very polite about it. People are very respectful with social distancing, and I think it's really an important measure of safety that they feel comfortable there. We're encouraging hand washing, and there are hand gel stations all around the buildings, and so hand gel is very easily accessible. And then behind the scenes, we're increasing cleaning, especially for high-touch areas. So these are 8 important measures. If we continue doing all 8 of these carefully, not only in our buildings, but also in the public areas, at Costco, at Safeway, at our homes, if we're really careful about public health measures, and in our buildings, careful about these 8 measures, I think we'll be okay. We've made this a remarkably safe environment.
Gary, we do a lot of screening questions, but it would be possible that somebody slips through. Has that been a problem for us?
So because we've been very diligent and vigilant here, we've only had a very, very small number of patients slip through the screening process and the triage process, and they come into the building, and we found out after the fact, oh, this patient was symptomatic, and they're tested and they're positive. In one specific of those cases, we've been very liberal, kind of a test of change, very liberal about testing everyone, including staff that were asymptomatic. And in that recent encounter, no one tested positive, and there's been no secondary cases. At that time, no one was symptomatic, but we were wondering, could there be asymptomatic people, staff, healthcare providers that might have become infected unknowingly? And it's really reassuring to me that none of those cases tested positive, and we haven't seen secondary spread in the clinics and even in the hospital yet. So I think that's been really important information.
Good. That's really encouraging. And it seems like every time we speak to you all, we come back to safety being our key initiative. And we found that to be the case. Just this morning we were examining all the clinics and what are their biggest barriers to providing care. And it seems like most mentioned that still the patient fear about coming back in. But you hear right now from Gary, we've got a good system set up. It's been very safe for all of us. So really do take advantage of every opportunity when you're dialoguing with patients to educate them about the safety measures we're taking. Don't wait for them to ask, because I think pretty much everybody out there has this underlying pervasive and understandable fear about coming in because of what they see or read in our social media. So I just wanted to finish up by saying, thanks for all the hard work you're doing. We're well into our recovery now, and we're providing much more care than we have in the past. Just last night, I was on a phone call with Dr. Liz Villardo, who is the CEO of the entire Bay Area Foundation, and she was reviewing the numbers, and she noted that for the month of June, the entire Bay Area is at about 71% level of what their budgeted billings were for this month. And then she went through the medical groups, and she was keen to point out that Smugger is indeed leading the groups. We are currently this month billing at about 87% of predicted budget. So keep up the hard work. It's paying off for everybody. So again, thanks for your time. Hope this is helpful. And Gary, thank you for your time.
Yeah, thanks very much. It's good to be here.